Under BLC's Injury Prevention and Recovery, today we are going to be talking about injury stats in the USA. As I began this career or passion for helping companies lower workman comp claims and injuries and providing education to the employees, before I started going into this journey, I really had some just basic questions about what was out there. I wanted to know how many injuries were in the US, what was driving the injuries, and what the outcomes were, and who was getting injured and when they were getting injured. And I stumbled upon a government website that provided all of that data. And much to my surprise, a lot of the assumptions I had about injuries were incorrect. And based on the stats I'll be talking about over the next couple slides, showcases how a lot of my assumptions were incorrect. Based on my first assumptions, I only thought maybe there was 100,000 to 200,000 injuries that happened in the US, knowing that the cost of each injury, both direct and indirect, are quite high. I really didn't think the overall number of injuries in the US was quite high, but much to my surprise, there was about 2.8 million injuries per year. And again, this number is only based on the private sector. It does not account for federal or local or state government agencies. And if we break down that 2.8 million, essentially you're looking at 7,700 per day, 324 per hour, and 5 every minute. And that rate of 5 every minute is pretty astonishing. So injuries are happening all the time, and I believe we might be missing 20 or 30% because of injuries that go undocumented or injuries that do happen within a day and don't get recorded, because again, this number is based on recorded injuries that factor into people missing days away from work. So even though this number is pretty significant at 2.8 million, in the back of my mind, injuries are probably higher than that. And if we were to focus on a type of injury, I think MSD specific injuries are a really good injury to talk about, because the US Bureau of Labor Statistics are really bringing more information about MSD specific injuries, and they're really focusing on the information that's out there about these type of injuries. And from BLC standpoint of view, again, a lot of our solutions is focused towards these type of injuries. So if we look at the overall numbers, there's 335,000 recorded cases in 2018. If we break that down, it's 918 per day, 39 per hour, and 1 every 2 minutes. So that rate of 1 every 2 minutes is pretty high. And again, the direct costs and indirect costs for just an MSD specific injury is pretty high, and it's starting to get higher each and every year. Now that we've answered how many, the next questions I had were when and who. And much of my speculation was that probably 95% of injuries happen to males because they work in labor intensive jobs such as manufacturing, distribution, so on and so forth. And really you hear about those type of injuries happening. And then at the same time, I always thought maybe injuries happen towards the end of the week, right? Where you're tired, you're fatigued, you're cleaning up, and you're essentially packing up all the heavy equipment that you unloaded earlier in the day. Your mind's not thinking about work at that point in time, it's thinking about the weekend, so you're not focused. And again, you might be having some aches and pains due to the work week, and then boom, all of a sudden an injury happens on Friday or towards the end of the week, and at the same time towards the end of the shift. But as I dive into the stats out there, a lot of my assumptions were incorrect. Understanding when injuries happen and who they happen to are two really important questions that we need to address. So if we look at when they happen, usually they happen early in the week. At 36%, most injuries happen on a Monday or Tuesday. And within any given day, they happen within the first 4 hours of a shift at 37%. So people are having a hard time transitioning from the weekend or uh, going from the evening and starting the workday. And I think using some sort of exercise program off the beginning each morning can go a long way in help preventing injuries and making sure people move more efficiently. And if we think of another profession out there, such as professional athletes, what do they do before a big game? They do some sort of warm up to get their body ready to compete. So we need to take that same approach when addressing the typical workday. And for average people that go to work Monday through Friday, 40 hours a week. And I think, again, having that set up, doing some sort of warm up or a couple exercises can really help people alleviate their pain and make them move a little bit better, whether they're labor intensive or sit behind a desk. Now that answers when. So who gets injured? Okay, so if we look at the age range, 35 to 55 is number one at 47%. And what that tells me is that people in your organization that have experience, or a manager or a leader, are getting injured. And so not only are the direct costs really high with that, but the indirect costs are really high because you have to shuffle their workload around. You might have to hire an temp. And the older you are, the harder it's to bounce back. And if someone experiences an MSD specific injury within that age range within your organization, then they are likely to miss somewhere between 15 to 30 days of work. So again, that's why those indirect costs can get really high. And if we looked at the ratio of male to female, it's relatively level. It's a 60-40 split. And if we look at the number one industry for workplace injuries, it's healthcare, and they are by far number one. Second place isn't even close. And so if we analyze that, why is healthcare number one? Well, if you use the analogy that a plumber's house is always leaky, then that can kind of apply to this, right? Healthcare people are really busy taking care of other people. They might not necessarily take care of themselves when you would assume they would because they're in healthcare, so they know what to do. But if you look at the profession of nurses, not only do they have a stressful job mentally of taking care of people and understanding what to do and when to do it to make sure no one gets hurt or you improve their health, they also have a physically demanding job, moving patients around, picking them up, moving pretty big equipment around. Okay, so they have a really high rate for MSD specific injuries. So if you look at the spectrum of jobs, right, and on one end you have healthcare professionals, nurses, females. On the other end, you have males in distribution, right? You can't take a cookie cutter stretching program and apply it to all because, again, that spectrum is so vast. So if you look at the one end with the healthcare professionals, the women usually tend to be a little bit more mobile and they might need more core control or stability work, whereas on the other end, the males, yes, they might need more mobility work. So it's really important to do some sort of human kinetic testing to see what's going on with your population and issues they might have from a movement standpoint and give them some exercises that they can do to really enhance or improve or create more durability within the body on their day-to-day movements. We have an understanding of who gets injured, when they get injured, how many. We can look at the results. So why are they getting injured? What are they doing to cause the injury? And then once they get injured, what's the outcome? What symptoms are they experiencing? And then last but not least, okay, which area of the body is experiencing the most issues. So if we look at those types of scenarios or those bullet points, it really sets the forefront for coming up with a solution to prevent injuries. For MSD specific injuries, the results are as follows. The number one reason why it happens is because of overexertion and bodily reaction at 99%. It's not so much repetitive motion, but people may be struggling to pick up a piece of equipment. So in their mind, they know they have to pick it up, but they don't know their body's limitation in picking it up, and all of a sudden an injury happens. So that's why we have to do some sort of human kinetic testing to make sure the employee is aware of their limitations so they don't overexert themselves and they can find a solution in order to help them pick up that object. And the number one outcome, so once an injury happens, they experience a sprain or strain at 70% and just basic soreness at 20%. And these symptoms are causing people to miss work from 12 to 30 days. And it relates to just kind of low common back pain or shoulder pain or knee pain or ankle pain. And a lot of this can be prevented, again, if we do some sort of warm-up exercise to make sure our muscles are firing appropriately on any given day. And I think for the most part, we all know, but the number one area of the body affected is the back/trunk at 45%. And interestingly enough, just low common back pain for industrialized countries is about $100 billion. So there is a lot out there in regards to people experiencing low back pain, but on a daily basis for many companies that have employees, just by implementing a couple exercises, a couple times a week or every day can really go a long way in trying to improve movement and alleviate that day-to-day pain. Now that we've answered some basic questions such as who, when, why, and what, we have to look at some solutions. And these are just 3 bullet points that I feel are worthy enough to be addressed and really try to explore in detail how we can deliver these results to companies and employees. So the first one is be athletic when lifting. And I know the common terminology out there is to get down low, use your legs, bend your knees when picking something up. And that's more of a squat pattern. So I think people are aware of that terminology, but I don't think it's ideal. Because for the squat pattern, most times people have a hard time doing it. Whereas if we look at more of a deadlift pattern, it's a little bit easier to do. So rather than your hips going straight down, they go straight back. And a perfect example of this is, for example, a shortstop in baseball or a point guard in basketball or a volleyball player. Okay, so if we use this terminology, it's simple, it's easy to understand, then I think it can go a long way in helping with lifting technique. The next one is understanding your movement. So if you know your physical limitations, then I think understanding what they are will really help with lifting things up or doing specific tasks at work. Okay, so if we know overexertion and bodily reaction is the number one reason why an injury happens, if we were to do some sort of human kinetic testing on your population or your work environment and the employees are aware of issues they might be having, then they might sit back and think of lifting something up and how it might affect them. So they're not overexerting themselves, but they're going to take a different approach to it. Maybe ask someone who's beside them to help out, or another solution that they might get creative with. Okay, so those are the first 2 bullet points. And the last one is desk setup. And it's really important to understand that not only work injuries happen to people in physically demanding jobs, but at the same time, people that are sitting at desks. So if we're encouraging people to start doing some sort of exercises, it's important that people that work at a desk do them as well too, because you're in a fixed position, and to do that all week long and then go to the weekend and then back to that work week, it's hard transition on your body. So we need to have an appropriate desk setup when it comes to ergonomics, but at the same time we need to get those people moving more, because ultimately if we move in a better way, then that lowers the risk of getting injured. So by just having those people move more is really important. So those are the three solutions I think we really need to address, and again dive into more detail about, to really help solve the big problem out there, which is workplace injuries and MSD specific injuries. Because the more education you have, the more information, then the likelihood of you getting injured starts to go down, because you are protecting yourself. So thank you very much. I'm glad you watched this video, and hopefully you learn some information that you could apply to your workplace or at home, and just kind of take a step back and try to think, how can I start moving better today?